Good morning. Good morning, everyone. Welcome to November 2020. I wanted to mention a couple of things as we start today. One is that we will be postponing the awarding of the Hearts grants until next month because one of our partners from the San Francisco General Hospital Foundation is ill today, so we're just going to carry that over till next month. The second thing I wanted to mention, we're going to have a full update from Lisa Winston on COVID, but as we all know, we're experiencing some increase in activity on that front. The third thing I wanted to mention, something very important is happening today, and that is that the Supreme Court of the United States is hearing a case this morning and today on the Affordable Care Act. And so we're keeping an eye on that to see kind of which way discussion goes. And then there will be a subsequent ruling on the constitutionality of the Affordable Care Act. So we all want to keep our eyes on that. With that, let me just run down what we're going to be talking about today. We're going to be starting with a review of what's happening with COVID. We're going to be hearing from occupational health, our occupational health team about needle stick, and then finally we're going to hear from Terry Saltz on capital projects, and then we'll have an open Q&A. So please be ready for that. You can use the chat function at any time to send your questions in, and we'll try to get to as many questions as we possibly can. With that, Lisa Winston, come on up.
Hi, everyone, and good morning. It's a pleasure to join you all and to be able to give an update on what's going on with COVID. And I'm going to kind of do this in reverse order, starting with the things that are not so good, a little bit depressing, and then we'll move to the areas that are more positive. So as Brett alluded to, we are entering a very challenging period in terms of COVID across the country, in the state of California, and locally. So, really everybody is immersed in the third wave, and I think it's just a question of how big it is going to be. But across the country, especially in the Midwestern areas, we're setting records in terms of the number of cases. And although the epidemiology has changed a little bit, and some of the cases are in people who are younger, so the hospitalization rates have not gone up quite as fast as the case rates have. Hospitals are getting overwhelmed. They're very busy, and it's continuing to be a challenging time. In California, we are also seeing an increase in cases across the state and a smaller increase in hospitalizations. And this is also true in the Bay Area. We have seen a substantial uptick in our cases locally. Santa Clara made an announcement this morning that they've seen a large increase in their cases. And, not surprisingly, we have seen the same thing in San Francisco. So in terms of what's going on in the hospital, we have seen over the last couple of weeks a gradual uptick in our cases, averaging, around 10 or 12 inpatients in the hospital. We are back to surge level yellow, at least on most days, and we are closely keeping an eye on it. So we are asking, as Brent said, for everyone's patience. We are going to be wearing masks, social distancing, avoiding gatherings, and really needing to be on our best behavior now for a considerable period of time, as we navigate this third wave, and hopefully, in the new year, start to move into, some new phases of where we are going. So that's kind of the epidemiology part of it. I will just say that in response to the increase in cases, both in the state and locally, there may be some pauses in terms of what is going to remain open, and whether there will be some pullback in terms of things that are allowed to be open in San Francisco. I do not have any of the details of that yet. Dr. Ehrlich is here. She may have some information about that, but I think we are all just, kind of waiting to hear what exactly the response will be, but I think everyone is appropriately cautious and concerned, and so you may see some changes about that. I think we can say that at the healthcare system level, we are not planning any immediate changes in terms of the levels of service that we are providing. And one of the things that we discussed yesterday, and I think this is a testament to, how well everyone's doing across the healthcare enterprise, for our patients about. So having contact with a healthcare system has not turned out to be a risk factor for getting COVID. So it's the other things. It's the, the gatherings, not social distancing, not wearing a mask. But when people come to healthcare systems, including our healthcare system, that has not been a risk factor for them in terms of acquiring COVID. Okay, I'm going to turn to a couple of other things. The first thing is what's going on at the federal level in terms of COVID-19 response. So just very briefly, the Biden and Harris transition team has announced the makeup of their COVID task force. And many people have probably seen this. There have been a lot of messages going around, but 3 members of the task force have affiliations with UCSF, and 2 of those members actually work on our campus here. So Dr. Kessler, who's a former FDA commissioner and actually a former dean of the medical school at UCSF, is one of the co-chairs of the commission. And then 2 of the other commissioners are members of our faculty. One is Dr. Eric Gooseby in the HIV ID Global Medicine Division, and the other is Dr. Robert Rodriguez, who is a member of the emergency department. And we are confident that they will provide excellent advice and information at the federal level as responses are being formulated. So we're just really pleased to see that we'll have such strong people taking the helm. Okay, and then the last thing that I wanted to talk about is areas where we, may have some truly good news. And the first thing that I want to mention in the therapeutics realm is monoclonal antibodies. And many people have probably seen that just yesterday, one of the monoclonal antibodies made by the company Eli Lilly received emergency use authorization from the FDA. And there is another monoclonal antibody product that has also submitted paperwork for emergency use authorization, and we expect to hear about that one soon. These monoclonal antibodies, unfortunately, did not work when they were given later in the disease to people who were already in the hospital, so already had significant illness. But there is some signal that they may be helpful if they are given early, particularly to people who are at high risk for developing significant disease and needing to be in the hospital. And so that's something that we're going to be actively looking at this week. these monoclonal antibodies may start to become available, although probably in very limited quantities. And there are significant logistical challenges with giving them because it is an IV infusion, and you do have to find people very early in the course of illness. So a group of us are going to be meeting to try to figure out if this is something that it would be feasible to offer here. But, many people have noted that thus far for COVID therapeutics, they've really all been geared to people who've been sick enough to be in the hospital. And this is the first thing that's coming out that has some data that may be available to people who are not yet sick enough to be in the hospital. So we're going to be looking at that very closely. And then I will end with the most exciting COVID news of the week, which I'm sure is on everyone's mind, and that is the press release that came out yesterday from Pfizer and BioNTech about their 44,000 person phase 3 study of an mRNA coronavirus vaccine. And so far, the only data that we have was the data that was contained in the press release, although it was a much more robust press release than sometimes comes out. And they've actually released the full protocol so everybody can take a look and see, who was enrolled and what the primary endpoints are. So Pfizer is definitely being praised for its, transparency in terms of getting the data out. So what did the data show? Well, what we know is that there appears to be about a 90% efficacy rate in terms of preventing symptomatic disease from COVID-19, which is very, very exciting. The preset threshold that, people wanted to get over to consider use of a vaccine in a widespread way was 50% efficacy. So this is, really, if it holds up that it's 90% effective, it will really be up there in terms of one of our more effective vaccines. Of course, there are lots of questions. We don't know over what period of time that efficacy will last. And we are still waiting for more safety data to be released. So there is supposed to be more safety data coming out in the next 1 to 2 weeks. Because before there is an application for emergency use authorization, at least half the people in the study have to make it to 2 months after getting their vaccine doses in order to evaluate whether the vaccine appears safe. And this trial started in July in terms of people starting to receive doses. So it is very exciting. We hope all the news will continue to be good. And the San Francisco General is working with the state and with the CDC to try to have this vaccine available here as soon as there is emergency use authorization, because healthcare workers, frontline healthcare workers, will be in the first group that gets vaccinated. And so we certainly hope that we will be able to offer it here as soon as we have all the safety and efficacy data that are needed, that it's fully evaluated at the FDA level, and that it is fully vetted at the state and local level, because it's going to go through multiple levels of review before it is going to be given outside of a clinical trial. So that's a lot. I will stop there, and maybe Brent can let me know if there's questions.
We've got a couple questions.
Great.
So you talked about the upward trend.
Yes.
A couple of things. One is, do we anticipate this trend turning into a spike, similar to the spike we've seen previously? And the other question is, how are we preparing this upward trend?
Yeah. So, in terms of the upward trend, I think everybody has probably seen the graphs, and they've been different depending where you are, how high the peaks were. But basically, we had peak 1, and we had peak 2, and now we're getting the trend upward for peak 3. So I think it is clear we are going to have a spike. We won't know, of course, we know we're going up. We won't know, of course, how high it's going to be until we come down. But actually, we have a lot of data now on the things that work and the things that we need to do to prepare. And I think sometimes we start to sound a little bit like a broken record. And, it's hard to keep saying, wear your mask, socially distance, avoid gatherings, but those are really the key things that we need to do and the things that will continue to keep us safe. At the hospital level, yes, there are meetings going on every day in terms of assessing the trends and making sure that we have the capacity both on the nursing and on the provider side of the house. So there are certainly surge plans in place. We hope we will not have to go too far down, our color list. In terms of responding, but we're going to be looking at that on a daily basis.
Great. Last question for you before I know you have to go. Going back to the vaccine.
Yes.
Do we have any indication about timing? Do we have any indication about distribution and logistics of that?
Yeah, great question. I'll start with the issue of timing. If the data continue to be good, the time could be short until the vaccine, starts to be distributed. Again, we're expecting more safety data to come out in about a week or 10 days. Once those data are available, the emergency use authorization could be submitted to the FDA by the end of November. And they will turn it around quickly, assuming they think there's sufficient data, which would mean that we could start potentially administering some doses of vaccine as early as December. Part of the whole planning for vaccination has been to start the manufacturing process early for the most likely vaccine candidates. And so there are supplies that have already been manufactured in anticipation of being able to administer it. But it will clearly be a ramp up with likely a relatively small number of doses available at the beginning. I'm keeping my fingers crossed, could be as early as December, with more doses rolling out, over the next month to healthcare workers, and then hopefully starting to expand outside of the healthcare worker community to the other tiers. But we don't know yet, how many. First, we have to get through making sure that we are sure that the vaccine is effective and safe, and then we'll find out how many doses we're getting. But ZSFG is planning to present a very transparent plan for how vaccine will initially be distributed. And even if people are not like in the very first group that's going to get the vaccine, the commitment is that we're going to get everyone vaccinated, as soon as we have a vaccine that's safe and effective. It just, may take a little while until all the doses are available, but very exciting. The other thing that's an unknown, but is also exciting is, having the first vaccine come out with positive data bodes very well for the vaccines that are coming behind it, particularly the second vaccine, the Moderna vaccine, that's likely to present data because it's a very similar technology. So, we're really hopeful that will mean that we may have multiple vaccines that are available, which would increase the number of people who could be vaccinated and, hopefully move the timetable sooner.
Thank you so much, Lisa.
Thank you. All right, take care, everybody.
Okay. So our next presenter, Katie, is going to talk about a program, and I think it's really indicative of understanding that COVID is a huge issue, but it's not the only issue, and we still have everything that we're doing as a hospital in addition to COVID response. So Katie is going to discuss the needle stick program. Okay. Are you? Okay. So Kim is going to go through your slides.
Okay, thank you.
Just sit right there.
Great. Terrific. And do I forward it?
Kim will
Advance it. Great. Well, hello, everyone, and good morning. I'm Katie Lynn Evelyn, nurse practitioner from Occupational Health Services, and I'm going to be speaking to you today about the DPH's Blood and Body Fluid Exposure Hotline, which you will know as the Needle Stick Hotline. Our goal today is to make sure that everybody understands what to do in the event of a bloodborne pathogen exposure. And so let's start. Next slide, please. Today we're going to talk about our program updates, just the who, what, and how of the hotline, a little word about source patient evaluation, and describe how we coordinate with UCSF. The Blood and Body Fluid Exposure Hotline ensures the timely medical response to occupational exposures to bloodborne pathogens. That's HIV, hepatitis B, and hepatitis C. As you may be aware, these diseases are quite prevalent in our populations that we treat. Our program is led by Jess Chuang with Rosalie Farrar, and together they combine a fantastic combination of innovation, technology, compassion, can-do attitude. The hotline is a 24/7 operation. It's a small program, but because it's 24/7, it's challenging to implement. It is staffed jointly by both ZSFG staff and UCSF physicians. And I will say all of them are compassionate and dedicated to the health and safety of workers. So we share that bond. Our program makes sure that the institution complies with Cal OSHA bloodborne pathogen standard. And of course, because of that, we partner very closely with DPH's Occupational Health and Safety Program. They do the deep dive on the statistics, looking at root causes, looking at equipment, and tries to engineer, their goal is to engineer out any hazards. So we enjoy a great partnership with them. In the last few months, we've had a number of program enhancements that you need to be aware of. The first one, happily, is that there is, even though we've changed the name, and I'll explain more why we've done that, there is no change in the number. There is one number, and it's listed here, 415-469-4411. We have changed our standard work, which allows us to really analyze every aspect of our operations, and has also already, in just a short period of time, allowed us to make necessary enhancements, improvements as we implement the program. We've also revised our program structure. There's a dedicated NP and RN available every day at ZSFG to man the program and answer calls. And we have a new focus on the mental health impacts for people who've been exposed, which already I've always felt that I was very sensitive to that issue, but by refocusing, I've really found that the mental health impacts are deep and profound when you've had an exposure. We're looking at somebody who's had a very sudden event in their life, which, the possibility of getting HIV or hepatitis C is a very real issue. And, there could be, this is real. People can be planning a family and you have to say you have to have safe sex for the next 6 weeks until we finish our testing. So it's profound and it's really an important change that we're making. We also, in the last year, have had an app-based paging system instead of the old beeper system, which we found to be very effective. And as you see here is a preview of our new poster for the blood and body fluid exposure hotline, and it includes the first 3 most important steps. And also but what's fabulous is it has the QR code in the bottom left-hand corner, which you can just scan, and it'll populate your contacts in your phone. So happily, even if you have an old poster, the same number will work, but it'll be very handy because there's confusion over the number. So these are at the printer. We're going to be distributing these throughout the health department. And we're also going to be issuing pocket cards that'll hang on our tags and also have the first steps and the hotline number. We also are going to be doing a website refresh with DPH's Occupational Health and Safety Program. So one source of confusion is who should call, and it is complex. Basically, our hotline here, the DPH ZSFG hotline, is for all city and county employees. And in fact, some of our biggest customers are police, fire, paramedics are probably our top, as well as the medical staff here in the hospitals. Also, any UCSF personnel, staff, students, residents, visiting students, anybody who's exposed at a DPH healthcare facility, please have them call our hotline. We also wish that any other students, contractors, anybody who's exposed at our facilities, call the hotline. We will help with the triage on those people. We will do the initial intake. We want this to be a quick, thorough, professional experience. Go ahead. So this slide shows a variety of ways that people can be exposed to a bloodborne pathogen. And it's the intersection of an infectious body fluid and the portal of entry. But we're not asking people to make any kind of decision whatsoever before they call the hotline. It's complicated. It can be very complicated. It's like, I pulled off the glove and there's blood. What happened? I don't even know. Or one just recently, I was wearing my face shield and a mask, but I had so much blood on my face that my coworkers told me to call the hotline. That happened last week. So these are the kinds of exposures that we see, and we want to take the time to carefully go through all the options with the exposed person because timeliness is essential. Go ahead. So the next 2 slides just are described the quick 4 steps that need to be taken. First is cleaning and decontaminate, and amazingly, sometimes people actually forget to decontaminate. They'll forget to flush their eyes. So there's a reminder there. Please just clean before you call. Call right away. Call the hotline as soon as possible, and a provider will call back within 15 minutes. If you don't hear back within 15, 20 minutes, please call the hotline again. We don't want people to hesitate to keep calling. And if there's any doubt about an exposure, please call the hotline for evaluation. That's a big reason why we're there. In past years, we've had somewhere between 300 and 360 calls a year, a little bit less this year. No surprise since we have a little bit less activity with some of our clinics. But we're seeing, I noticed that in the past, like 60% of the calls would be not a true exposure. And this year, I'm seeing more true exposures. And we want to see it padded so that people feel comfortable to call and get an assessment, even if they're not sure if there's an exposure. So please call if there's any doubt. We're happy to discuss it. And then, of course, it's important that the employee inform their supervisor. There will be injury reports that need to be followed and possibly a workers' compensation paperwork. And then we ask that there be follow-up with the recommended treatment. Our old guidelines, there was more of an emphasis on an ED referral or show up at the ED. We're really not recommending that unless a referral is truly needed. The ED has other things that they need to do. Of course, bite injuries, dirty wounds, of course, need to be seen at the ED. But the main thing is that we want to get people in as soon as possible to assess whether they need that post-exposure prophylaxis, because it needs to be given as soon as possible. Definitely within 72 hours. After 72 hours, that window is closed shut. There is no way to treat. And then follow-up care is typically done at occupational health services for the initial care at least, and our numbers are listed there. So this is the workflow. The main thing I want to point out is when the exposed person calls the hotline, they do not directly reach a clinician. They go through a call center. And we are working very hard with our call center, setting up scripts, making sure that things flow well through the call center, because the call center serves more than just the ZSFG hotline. They also serve the UC. They also are channeled into UCSF. They know about the Clinician Consultation Center, and actually the VA and ZSFG share the exact same number. So that has been a source of confusion that we've been working very hard to rectify. So one of the things that we're doing is confirming that the person has called the correct hotline and doing a soft handoff if there's any problem with that. And also, if there's a true exposure, then we need to get the source patient consent and lab, and there'll be a little discussion about that in a moment. And again, then the provider provides counseling to the exposed person, prescribes the PEP, makes the follow-up plan. So the source patient evaluation is a critical piece to the whole assessment of exposure. The administrative policy, bloodborne pathogen patient and source policy 8.06 actually goes into the detail of this. There's also a companion policy if the healthcare worker is the source of infection or source of exposure rather. And so the main thing that you need to be aware of right up front is that the exposed person should never initiate or participate in the source patient testing process. They should not obtain consent, nor should they draw the blood. The charge nurse or another provider should obtain that informed consent and source patient blood. Currently, the source patient labs are still found on the ZSFG CHN intranet website, and the purpose of that is so that the source patient does not get charged for the blood work. And then we are expecting the EPIC order set to be available in February of 2021, because that requires programming. So we coordinate with UCSF in other important ways. As I mentioned, the on-call provider is going to check that the right hotline was reached, so we have that safety net going. So we have hotlines for ZSFG, UCSF, the VA, and also the UCSF Clinician Consultation Center. And the purpose of that Clinician Consultation Center is to provide support, direction, and advice for providers who have questions about their own patients who've had an exposure. So we've kind of engineered out that triage from the call center because it was becoming too confusing for them to know when to make that call. So if a clinician needs advice from the clinician consultation and accidentally calls the hotline, we'll make that call. We'll direct them to the correct line. Also, ZSFG Occupational Health will treat UCSF staff or students if the incident occurred at a DPH facility, and they may continue their care at either UCSF or ZSFG Occupational Health. And Occupational Health will coordinate with the UCSF needle stick program to do a soft handoff to make sure that continuity of care, and it can be flexed back and forth because we know people do move back and forth. So that concludes this brief overview. Thank you from our team, which is a multidisciplinary team, ZSFG, UCSF, and DPH. The more we communicate, the more I think the better our program is becoming. We do share that value of making sure that everybody gets the prompt care that they need. I think we have a very dedicated and fantastic colleagues in these other programs as well. And we also want to give a special thank you to Susan Brekovich from Risk Management, who's been so helpful to us in occupational health with her guidance and advice on improving our program, our standard work, and her other suggestions. So thank you, Susan, and thank you all.
Katie, thanks so much. Can I just ask you one quick question before you wheel away? Can you give just sort of an overview? How many incidents do we have a year?
Yes.
Of what type? Are they all needle sticks?
Yes, those are great questions. Looking back from 2017, the numbers have actually dropped every year. Looking from 2017, 18, 19, and then 2020, we had about 250, 260 events in 2017, and that dropped down to about 300 in 2019. And a large percentage of those were actually found not to be true exposures. The percentile has actually dropped, to me, worrisomely. So this year we have around 200 calls so far, but about 98% of them are actually turned out to be true exposures. I would expect to see more questionable exposures in there, because when the margins get too low, it just makes me wonder, is everybody really accessing and calling and doing what they need to do? The good news is, because of the one thing for COVID is that people are wearing eye protection and face shields. We know that we've changed the name of the needle stick hotline because it's not just needle sticks. I don't have the figures handy to tell you exactly what the proportion is, but splashes far outweigh the number of percutaneous exposures. So we have seen less, I think, because of the use of the eye protection and face shield. But, time will tell because it's very recent.
Thank you so much, Katie.
Okay.
We'll have some more questions later. Sure.
Thank you.
Thank you. Okay. Terry, what do you think?
I think that's my time to show.
I think it is. All right, my friend.
Good morning, everybody. I'm here to talk to you about capital projects and activities on campus. The three active projects that we have going on with on campus is from the Zuckerberg side is the Rehabilitation Department, 6H Surge Office, and Poison Control. All three of these projects are coming towards their end. We hope to complete 6H and Poison Control by the end of the year, with rehab to follow right behind it. Rehab will have a much longer transition timeline after completion of construction, including fit up, training, orientation, and licensing. So there'll be more in that schedule as it gets developed. And then the new projects that are going to start up on the heels of these projects is, actually we've already started. We've initiated the projects for dialysis and the public health lab. You'll soon start seeing some barricades in the corridors and hallways. The contractor has been instructed to maintain 6 feet in the corridor, but you'll start seeing that real soon. We just had our pre-construction meeting with Oshpod, and they gave us the okay to move ahead. The other project that you'll see activity in the beginning of the year will be the seismic project. You'll first see activity in the pharmacy area, where we will have to do work in the back of the pharmacy, which means that we will be pushing the pharmacy operations out towards the registration desk, and thus we've moved the registration operations to the main lobby. And you'll see some of that activity starting in the first quarter of the year, sometime in the first quarter. Those dates are kind of in flux right now. The UCSF research project, if you had a chance to see that, that's going like gangbusters. They are slated to continue construction through 2023, actually early 2023. I must say I view that site from my office every day, and it's really an efficient, well-run construction project, and there's a lot of activity going on now that they've gotten started. and they're doing quite a great job. There's an element that's going to be impacting the pedestrian pathway from the 23rd Street that I'd like to mention. There's a notice that went out. Some of the dates might be fluctuating, but it looks like November 16th, we're going to be reconfiguring the pedestrian pathway. Just detour a little bit because they need to do some digging, excavation out in the driveway to bring in fire hydrants, 2 new fire hydrants. So that work is going to continue from the 16th through the first or second week of December. And that's going to involve some potholing, some trench digging. It's also going to restrict the pathway for vehicles on the turnaround. So what you will see is by the south entrance there, you will see the lane go to 1 lane around the turnaround for a short period. And then on Saturdays, they'll be doing some work. They'll restrict the entire driveway to 1 lane, but they'll have flaggers and traffic control and take the proper precautions. That's all for waterline work to support the fire hydrants. Additionally, on site, they're doing excavation and forming, doing form work and concrete work to support the new ramp going out to Vermont. That's going to be for the roadway, which the roadway, of course, is going to be delivered early. It's not going to be all the way out to the end of or the beginning of 2023. It should be available for use this spring. And that'll be a path from the south turnaround all the way out to Vermont. The other work that they're doing right now, which is kind of exciting, is they're doing micropile drilling, where they're basically drilling down into the bedrock and they're pouring concrete and grout to form piles that will support the building. And that's going on right now. So noisy work. The drilling is noisy. Sometimes when it hits something solid in the earth, you'll hear some rolling, but it's momentary. It's not a prolonged noise. And then there's going to be some vibration for soil compacting, and they'll be using jackhammers ad hoc periodically as they form the foundations. Mitigations for dust are underway. They have a water truck that moves around the site and keeps the soil wet so that the dust does not flow around. And they have noise level monitoring and dust monitoring going on. So we're looking forward to that project continuing on the path that it is. That completes the capital projects. I do want to mention that there is still San Bruno parking available. So if you're interested in parking at San Bruno, there are permits still available at that location. Any questions?
Yes, there are. So, Terry, what's the update on the security around 9, 30, and 40, and the installation of, I guess, phones to go
So the plan for building 9, 40, and 30 is to lock down the access to 40 and 30, but leave 9 still open to the public. And the way that it will be locked down will be similar to buildings 10 or 1, 10, and 20, where we will use card key access at control doors. The difference being that we are installing an intercom that will allow people to buzz certain units in 40 and 30, and through the phone system be allowed to buzz in. Alternatively, also, if someone had a cell phone they could call, or any number they would call, they would be able, the person who received the call can use a code to buzz them in as well.
And do you have a time?
So that one got really complicated on us because there was an IT component to this that had to run we had to create a server in building 25 for this to work and talk to the phone system. So that was just worked out. I just received the proposal, and as soon as I approve that, we'll be initiating, ordering the parts and installing. So soon.
Okay. Thank you.
All right. Thank you, sir.
Okay. So again, we're going to start a period of open Q&A. So please use the chat function, and we'll get to as many questions as possible. Susan, why don't you come up and we'll get that started.
Good morning, everybody. So I wanted to just extend a big thank you to our panelists this morning for the excellent information about COVID, the formerly known as needle stick hotline, blood and body fluid hotline, and for the capital projects. I just wanted to reflect on a couple of things this morning. One is just related to COVID and the situation here. So we're entering a period of time, you know, the holiday time, when most of us, the main thing we want to do is get together with our family and friends in cozy, warm rooms, have big meals that last for hours, and talk a lot and laugh and, you know, just have a good time. And sadly, that is exactly the kind of behavior that we cannot do right now in order to mitigate the spread of the virus. So, you know, that's really hard, right? I mean, it's hard to, you know, to not be able to do that in this time, especially since 2020 has been such a hard year for so many reasons. So what I'm going to appeal to you to do right now is just appeal to your sense of community responsibility. And, you know, we all are going to need to do things a little bit differently this holiday season, avoid those kind of gatherings I just described, you know, not travel as we're accustomed to doing, and really do this to keep our loved ones and our community safe. And this is, you know, we're so lucky, and I'm so grateful to be living in a community where our response to the pandemic has been guided by science, data, and facts. And that is what has kept the case rate in this community relatively low, you know, compared to the rest of the nation. It's what has kept the death rate very, very low compared to the rest of the nation. And so, you know, I guess I'm just asking for your help as we enter this time that's going to be really hard for a lot of us. And that help is, you know, it's going to be temporary, right? You know, this time will pass. We heard some really good news about the vaccine coming to ZSFG, coming to our communities, and so we know it's going to end sometime soon, but not soon enough for these holidays. So I want to thank you for your work on that. We can expect this morning likely to hear some news from the mayor and Dr. Colfax about the way the community is going to respond to the increasing caseload. We already saw that earlier when reopenings were paused. We may see some more of that in response to the rising caseload. I don't know the details of that right now, but those details should be out this week. I also wanted to respond a little bit further to what we're doing to respond. I think there was a question about the LAC site, the field hospital. You know, that site is really only meant to be open when all hospital capacity is completely exhausted, and we are far from that. Even during the first and the second surge, which was the biggest surge we've had in April, we were well within our hospitals, our community hospitals capacity. So, you know, we hope we'll never need to open that LAC site. We certainly can if we need to, but you know, our expectation is that we shouldn't need to, because we will be always assessing what we need to do in the community to prevent hospitalizations and you know, keep things within our existing capacity. I think I'll stop there and see what questions we have.
So if you could, can you address a little bit about the vaccine? And Lisa mentioned it in passing about various tiers of people who get it and what the decision criteria might be. Yeah. Could you go into a little more detail about that?
So first of all, to say, On Friday, Dr. Day and I signed an agreement or an application for an agreement with the Centers for Disease Control to become a pre-positioning site, which means that we would be one of the initial hospitals in the United States to receive vaccine. So first of all, we expect that application to be approved. We expect to be a pre-positioning site, but it hasn't happened yet. Secondly, if and when we get the vaccine, it's going to be in a very small quantity. So we already know that we're going to have to be very thoughtful about how we allocate the vaccine to be sure that the people who most need it get it first. And so we've already been looking at resources that are available at the state and national level about different schema for allocating the vaccine. Knowing that there'll eventually be enough vaccine for everybody, we just want to tier that so that the people who are at most risk get it first. Those plans are still in evolution, but we can expect that frontline workers, meaning workers who are with patients every day, in the highest risk sites like the emergency department and psych emergency would be among the first to get it. But that's really all I can say at this point because those plans are still in development. It's going to be very transparent to everybody how we think about that. So don't worry, there's no concrete plans, and we don't have the vaccine. We don't even yet have the freezer we need to store the vaccine because it requires a minus 70 degree temperature. So we're working on doing everything we need to do to have the capability to have the vaccine and distribute it.
Can you give any insight about this? What the health officer order about the reclosings might sort of look like, just to kind of give buckets of it?
Yeah, so I don't have the details about that. What I would anticipate is that the things that we know based on the evidence to be the highest risk things would be the things that would close. So things like eating indoors in restaurants, going inside to bars, being in large gatherings, all of those things are the things that we'd be most likely to pause. Beyond that, I can't give you the details, but again, we should see more from the mayor and Drs. Colfax and Aragon today or later this week.
Anything in closing?
Well, just thank you. This has been such a hard year. It's not going to get a lot easier. This transition period between the current administration and the next administration, it's about 70 days. We can expect that to be a time that is very unsettled. So with that, with the surge we're going to be seeing in COVID, it's going to get harder before it gets easier. And I still feel so optimistic because of the community that we live in, because of this place where we work together, and we've worked so effectively to take care of the community and take care of our patients. So I just want to express my gratitude, say thank you, appreciate your resilience and patience, and let me know how I can best support you all. Thank you.
Thank you. Thank you all. We'll see you next month.